25% of people with diabetes will have foot complication. And that includes ulcer, infection, and even sometimes amputations.
Yeah.
So today we'll go over how does diabetes affect your feet.
We're going to talk about what to expect when you go to the podiatrist when you're diabetic.
And also prevention tips to make sure you don't get those complications.
And we want to keep your feet healthy.
Hi everyone, welcome back to Step Sisters. I'm Dr. Richard.
And I'm Dr. Blanchett.
We're both board-certified podiatrists and foot and ankle surgeons. So why are your feet at risk with diabetes? There's three main reasons. Because it can affect your nerves, it can affect your circulation, and it can also decrease your ability to fight infection.
And when we're talking about affecting the nerves, this is called neuropathy. There's actually three main neuropathy that are affecting the feet. The first one is sensory neuropathy, motor neuropathy, and autonomic neuropathy.
Sensory neuropathy is the one where you're gonna lose the ability to feel your feet. And the symptoms you're gonna have is numbness, tingling, sometimes even burning sensation that can even happen when you're at rest or when you sleep.
Motor neuropathy is when you're gonna have an imbalance between the long muscle of the leg and the small muscle of the feet. And they're gonna start to be atrophied. When they're atrophied, the long muscle of the leg start to be overpowering the small muscle. The toes are gonna start to be crooked and hammer toe. And what happens is that it causes some point of pressure. It causes a point of pressure on the top of the toes, at the tip of the toe, and also on the bottom of the metatarsal heads, where you can have an ulceration, which you might not feel
because of the sensory neuropathy.
Exactly.
Now, autonomic neuropathy is the one that will affect the skin, more specifically your sweat glands. So with this, the symptoms will be that the skin will be more dry, and that can lead to cracks and fissure on your skin.
Our skin is colonized with bacteria. We all have bacteria on our body. Now that the skin is broken, a bacteria is very small, microscopic. For them to see a fissure, it's a huge portal of entry, which can lead to an infection. With diabetes, you can have decreased ability to fight infection. And that's a big problem because what we talked about earlier, you don't feel your feet, you have a point of pressure because of your hammer toes. Now you have a little bit of a cut in the skin, and then a bacteria comes in. And then your body is unable to fight the infection, and we get those raging infections that we see all the time in the hospitals.
There's a lot of study that proves that when your HbA1c is higher than 8%, your immune response is really decreased and your ability to heal.
It's always shocking. We're getting called for a patient that has raging infection. Sometimes it can be a gas gangrene, necrotizing infection, meaning the flesh-eating bacteria. And then you look at the labs, and their labs are normal. They don't have any increase of their white count cells, which is insane. They don't have a fever. Their foot is about to fall off, but they don't have a fever. They don't feel sick because their body is unable to build that response to fight the infection.
Decrease circulation. So the change in blood sugar will affect the vessels, which will lead them to be reduced in size, harden, and it will just decrease the blood flow in your lower extremity.
Try to picture this scenario. You have an ulcer on your toe because you have hammer toe. You can't feel it. And now you don't have good circulation because the furthest vessel away from the heart is on the toe. And it's very difficult to heal those wounds because of this triad.
Let's talk about what to expect when you go see a podiatrist.
So we're gonna look at all those things that we just mentioned about before. We're gonna look at your sensation. This is usually done by using a monofilament, which is a small little device. And we're gonna touch your feet on 10 different points. If you feel 6 or less, you're considered of having loss of protective sensation, meaning that you can't base yourself on like, oh, this shoe feels comfortable, I'm okay walking barefoot. No, because you don't have the ability to feel and to protect your feet anymore because you have less sensation.
Additional tests that we can do is vibration. We test a different area to see where you can feel the vibration.
And then usually the vibration kind of picks up something before even the monofilament picks it up.
Yeah, it's one of the first one to go, yeah.
Did you know that there's actually 2 pulses that we always look on the feet? The first one is called the dorsalis pedis. It's on the top of the foot. Second one is called posterior tibial artery, and it's located behind the medial malleolus.
Another test that we can do for vascular supply is to look at the capillary refill time. So when we press on your skin, it blanches, but it should become your regular skin color within 3 seconds. If not, you do have impaired vascularity.
If any of those tests become abnormal, there's a few things that your provider might do. One of them can be to have a handheld Doppler and to try to listen to the pulsation. The other thing that can be done also are vascular studies. Those are a little bit more advanced. They can include to do an ABI, which is an ankle brachial index. You compare the blood pressure of your ankle versus the blood pressure on your arms and also on your calf, your ankle, and even at the tip of the toes.
In conjunction with the ABI, we often do PVRs, which is pulse volume recording, and it's gonna help us to see the elasticity of your arteries. If some of those tests become abnormal, we usually refer to a vascular surgeon who's gonna be able to do either additional tests and also treat the poor circulation.
When you come to visit your podiatrist, they're gonna be evaluating your skin. Like we said earlier, autonomic neuropathy can cause dry skin. So we're going to evaluate to see if there is any type of dry skin. Sometimes also dry skin is not just that. Sometimes it can actually be fungus. So that's another thing also that can be evaluated and treated. We also evaluate to see if there's any calluses. Because a callus is what leads to an ulceration. A callus is there because of a point of pressure, and the callus increases that same pressure by 30%. And at some point, the skin underneath it just can't withstand the pressure, and it breaks down.
Next thing we'll do is a biomechanical examination. So that means we want to see if you have any abnormalities or deformities on your feet. Also really important to take a look at their shoes.
You can have shoes that are going to be too small. You can have shoes that sometimes have a seam inside the shoes and is going to be rubbing and causing some issues and some ulceration, as we just mentioned. Talking about shoes, Medicare, and then usually most of the commercial insurance can cover for a diabetic shoe and a diabetic insert once a year.
You do need to meet certain criteria, including neuropathy, deformity, that your podiatrist will be able to evaluate.
How at risk they are to have an ulcer or an amputation. And patients that don't have great risk, we're going to see them usually once a year. Sometimes every 6 months if there is something else. But we have some patients that actually need to come back every 9 weeks to be able to get something that we call at-risk foot care. So at-risk foot care is when you need to have your toenails trimmed by a professional, not at home, because if you're at home, you might cut yourself and then you might have issues with that. Same thing with callus management. So we're going to take a look at the point of pressure, see where the calluses are, and shape the calluses to decrease the chance of ulceration.
Let's talk about prevention. We want to make sure that the complication we just talked about don't happen to you.
First of all, you can moisturize your feet every day. Moisturize on the bottom, on the top, but don't go between the toes because they can trap moisture and they can cause other issues.
Next, make sure you check your feet every day. I know it can be hard to be able to look on the bottom of your feet, but if it's the case, you can place a mirror on the ground, hover your foot over it, so then you can see what's going on underneath.
I think that's very important also is not to walk barefoot because you might have neuropathy and then you might step on something. We've had a lot of patients that stepped on sewing needle, thumbtack, and
a nail.
That's not good. Exactly.
Very important to control your blood sugar. So that's the number one thing you can do to avoid complication in your feet, but also everywhere else for your eyes, your heart, your kidneys. Make sure your blood sugar is controlled.
Lastly, prevention. It's very important for every diabetic, no matter if you have neuropathy or PVD, to see your podiatrist at least once a year. And if you have any of the above, you're probably gonna have to see your podiatrist much more often. And then the most important thing of all is if you
See something, say something.
Even if your appointment is gonna be in 2 days, 3 days, 2 months, 6 months, if there's a change in your feet, you need to take that phone, call your podiatrist to make an appointment to make sure that this is not gonna turn into something bigger. Well, that's it for today. I hope you enjoyed the episode and then you learned something. And then make sure you share this with a diabetic you love. I'm sure you know one.
Click subscribe and the notification button so you know when we post next.
See you at the next
Bye.
video. Bye.